Dynamic that I would not expect a funeral home would be faced with during the course of my career.
Different indeed. The opioid crisis in Northeast Ohio changing how those who provide afterlife care do their jobs. Not only are they seeing more overdose deaths, each one brings its own unique challenges that could leave funeral home staff and their guests at risk.
From accidental exposure to powerful drugs to fights breaking out during a service, it is the new reality for those who consider themselves the last responders to this deadly problem.
Awful situation in News 5's Mike Brookbank has a closer look at how funeral homes are really changing with the times, Mike.
Yeah, they sure are, Frank and Danita. The National Funeral Directors Association is now recommending that its members across the country train their staff on how to recognize signs of an overdose and make sure they're also prepared to administer Narcan. For so many,
There's no end in sight.
the search for that next high
It's shattering families.
costs them everything.
We see the end result here at the funeral home.
Mark Bush sees 4 to 6 overdose deaths every month.
It's heartbreaking.
Right now, some funeral homes are not taking chances, implementing a Narcan protocol.
It is something that we are considering and evaluating at this time.
Bush tells me there's growing concern in his line of work as he watches this crisis escalate.
I've had colleagues of mine that have had overdoses occur within their funeral homes.
Guests at memorial services for a friend or family member who OD'd getting high.
That's the unbelievable power and grip of this drug that can't be broken by someone just seeing that they've had the death of their friend.
Bush says the ruthless cycle of overdoses knows no bounds.
We've not only buried and or provided services for one member of a family, but we've provided services for another member of the same family.
Exposure to dangerous drugs, not the only safety threat surfacing. Who's among the mourners could also lead to trouble.
It's a different dynamic that I would not expect a funeral home would be faced with during the course of my career.
In many overdose deaths, Bush sees angry, divided families, leaving funeral home staff in the middle as tensions rise.
We become an arbitrator, a mediator. One side of the family over here, the other side of the family over here.
As a steady stream of grief-stricken families come in,
It is a crisis that I still do not believe is being adequately addressed.
Bush brainstorming ways to help turn the tide, floating the idea of having recovery teams outside services for people who overdose.
Anybody that was faced with an addiction that needed treatment could have walked out to the parking lot and been taken immediately to a recovery center.
The National Funeral Directors Association just received a $17,000 grant to roll out 4 new social media PSAs that funeral homes are soon going to be using to raise awareness about the overdose crisis and other stigmatized deaths like suicide. In the studio tonight, Mike Brookbank, News 5.